think we need to invest all in that.
Yeah.
That's what you get.
Call meeting to order for the Board of Health, June 11th, 2025 meeting. Agenda basically is the same as always, a few minor changes. So is there, has everyone had a chance to review the meeting from the last meeting minutes from our March meeting? If so, is there a motion to approve those minutes?
So moved.
Second,
Okay.
all in favor?
Aye.
Carried. Old business. Amy, who wants to
Yep.
lead off this?
So, last time we talked, we were heading to the Confluence Conference that had the Board of Health track. Great turnout. There was like 280 individuals, I
Yeah.
want to say. And they started rolling out what's called the Foundational Public Health Assessment. And they've gone around to all 56 counties and are just trying to see like what public health offices need as far as like, is it policy and procedure help? Is it all that kind of stuff? So we did get a set. It's a pretty big assessment. So I was going to send it to you guys in an email so you guys could read it. And then also they're discussing, it's called Montana 21C. And it's this cohort that's coming together to kind of, it's the Montana Public Health Institute, the Montana Public Health Foundation. So all of the entities that are outside of like DPHHS are coming together to work together as like an outside entity for public health. So I will bring more stuff on that next meeting. Just because there's not a ton out. I will send you guys the website link so you guys can check it out. But ideally, I'd like Megan Gillespie to come kind of talk to you guys and so you guys can understand it a little bit better. But that's just kind of what went there. Our community health assessment, that's the CHA that we put out to the community. That's that survey. We did have, we partnered with Logan Health, and so they sent out mailers. We did handwritten and the QR codes around the communities. We did have 3 ballot box placed strategically around the community. So the senior centers, Horizon Lodge, different things like that for individuals that didn't want to do the QR codes and scanning the surveys and stuff. I want to say for hours, we got 52 responses. Unfortunately, I'm not sure what the mailers got. And so that is being analyzed by the Rural Hospital Institute out of Bozeman. So once we get all that information back, we kind of have a better idea on what that is. So.
Anything else on that?
Nope.
Next up is our disaster emergency services coordinator position. We had quite a few applicants over a stretch of time. Obviously, we were still looking back in March, our previous meeting. And so we had 2 experienced DES people apply and several with no experience or very little. And we have offered the position to one person and they will respond by tomorrow whether they're going to take it. But it will be a person, it is a person that it was offered to that has no experience in DES. So it will be a learning curve for everyone, but he's a really bright, positive candidate, and I think we'd be very, very fortunate to get her. Hopefully we get a positive on that. We start the training. New business, Amy, you want to go?
Yeah, so we would like to close the office for next week in the morning. They are doing, it's called the Montana Summer Summit, and it is for public health. It's a week conference that they hold in Big Sky that we were lucky enough to kind of get a cheat code, I guess, like a promo code, and get it for our office for $400 versus sending someone there for the registration of $1,500 just for the conference. So I would like all the staff to be able to be present for this training in the morning. So I just wanted to make sure that that would be okay to close with the commissioners, the board's approval. So we could get that staffing done.
Does anyone have any concerns on closing the office in the mornings for that week?
Yeah.
Think we need to vote then, do we?
I don't think so.
Cool. Then who came down with measles?
Shannon.
So measles is in Montana, first time since 1990. There have been 20 cases so far, 2 people hospitalized. Luckily, nobody has died. It has been in surrounding counties. Haber just had another worry about some. There has been some in Kalispell area as well as Gallatin County and Bozeman. So to be prepared, I did have, which I don't think there's enough for everyone, but if you guys can share these are the proposed, letter to send out to close contacts as well as the press release, and I just, made these so that hopefully we can just be on top of it, and if we do have a case or a case close to us, I can send these out and they are just ready. I wanted, the board to review them and make sure they were okay with you guys, and if they are, they'll just hopefully be saved on my desktop until I never have to use them, but, in case we do, they're there. I also am working on looking at my standing orders for giving the MMR vaccine. In case we do have an outbreak, I can look at giving, a different age population the MMR vaccine, or giving it early, to some folks, some of the little ones, if we have one. I don't want to implement that unless we have something closer to us or even maybe in our county. I know that there are some physicians that are offering it early. So, until we need it, I don't want to let the health department change my standing orders. So, I'll work with Dr. Taylor if I need that, but, yeah, we're just hoping and that it stays away from here and we can all stay healthy, but.
Any questions?
What's the major risk of measles? I mean, I had it when I was a kid and everyone in my class had it and, there was no shot of any kind. Is it?
Or more systemic ones, I think encephalitis or hearing loss.
Yeah.
And some of that, I think hearing loss is a big one, which is again neurologic function. And I don't know statistically, it's less than 1 in 100, I think.
I don't
It's
know what the stats are.
Challenges when you get big outbreaks, those numbers can sometimes sound big, but they grow. So it's maybe just trying to avoid or prevent any those adverse effects. If there's any cardiac complications.
And then,
Look back exactly, but.
yeah, and then, I mean, yes, majority of people are okay if they get it. I mean, their systems are able to do it, but they're the systemic effects, and then there's people who get hospitalized. With Texas had a couple deaths, and
Kids and older adults are gonna be pneumonias,
Yep.
other things like that too.
so really just protecting those whose bodies aren't able to protect themselves.
I gotta be give vaccine to them.
Right now it's a year, years when you start, but
Yep.
there's some, and this, I did this.
Yeah.
This.
So yeah, normally you get MMR vaccine at a year old and then you get your second dose, between 3 to 4 years old. There is if there's extenuating circumstances, if you're traveling to places that have an outbreak of measles, you can get it as early as 6 months. That doesn't count for your school vaccine, so you still have to get another 2 after the age of 1. But it can protect you. So there are places looking at outbreaks that I know, Gallatin County, I think quite a few people are looking at that because there is a current outbreak. to start giving it at 6 months to help protect those younger individuals.
Any other questions? Health Department report.
So the grant that I had told you guys about in March, the $250,000 one, we were awarded it. So we do have that. It's for the next 2 years for behavioral health. So I'm gonna kind of put Casey on that, being that we are not sure if Alliance for Youth is going to be renewing their contract this year. There's been a few budget cuts and they have not been sent an RFP or anything to be able to put in for a contract for this next grant year. So unfortunately, I think as of September, Alliance for Youth will be done. And then Casey will start transitioning into this near-term initiative grant. On that, it's kind of at the bottom, but with that grant, I just applied for another grant for $15,000 for equipment for a community telehealth counseling room. I have talked to a few people. I'm still trying to figure out where I would be able to put this, but what we're looking at is to be able to have everything for telehealth services for an individual, whether they have a counselor already or not. We're hoping to put it in like a JotForm form where you can just make your own appointment and then you'll receive a text through us. It's a little program. It's called Easy Text, and it'll give you a security code number, be able to get into that door. So I did put in for 6 VR headsets, a laptop screen. The VR headsets are showing that they are doing great things for younger kids. They don't recommend them for 12 and older, I learned, because VR headsets, or 12 and younger, excuse me, because evidently your neck muscles are not strong enough to hold the VR headset up. I learned that, new things. So I do have a meeting with, his name is Andre Balstrid. He is the one that I had talked to you guys about. He does Invinza Kids. He is partnering with Harvard or Yale or something like that. But he will be the one that does the platform, and that one's called Manage XR. And so I meet with him tomorrow morning, and we'll kind of have conversations about that. So if anybody knows of a place that in the community, my hopes were the library. Just because it's open late 2 nights a week, an individual could walk into the library and no one knows whether they're getting a book or going to counseling. But evidently the library does not have any extra rooms. So if anybody has any ideas of where we would be able to put a spot that's still like community accessible, but not like, oh, hey, someone's car's parked outside Pam's office, like, just because I know that's a lot of the community too. So someplace that is kind of inconspicuous, but still, but yeah, I'm open to all kinds of ideas and options. We did talk to Kim Hofstad about a couple of the rental places that they do have around, but kind of pricey. And being that it would be only funded for this 2-year initiative grant, I really don't want to put something into place that I wouldn't be able to sustain, especially if this is a great thing for the community to be able to use. So any thoughts on that, I would greatly, greatly appreciate. Chronic disease, they are making cuts there also. We are going to kind of transition people around. Cassie and Casey will be working chronic disease coming up this next grant year. Immunization grant went back to normal from last year. Last year it went up. It still had some COVID funds to it, but this year it went back down to the $3,000. So with that, I mean, we get paid $3,452 a year for our immunization. So we definitely have to tap into our general budget to be able to afford vaccines and stuff, because I think close to last year, we almost spent $120,000 on vaccines.
One box of vaccines is usually $3,000.
So, yeah, that's unfortunate. The town pump grant that Casey wrote for the $5,000 for Hard Butte, we have distributed all of that. We were able to get, I want to say 550 sack lunches out. to Heartview for the last year, so they should have some for the summer too, if they need be. And then I don't think anything else there. We do have Smiles Across Montana coming. There's flyers, everywhere. This is a great opportunity for Conrad. They come to our schools. But if you don't have health insurance that will cover your dental bills or anything like this is the same kind of program that the Blue Cross Blue Shield Caravan has. So whatever your insurance does not cover, they will pay and they will help you like get to a dentist if you don't have one. This will be at the senior center. It's on Jotform to be able to make your own appointments. There's a consent form on there. They're here for 3 days in the end of July and then they'll be back again in August. So yeah, please take advantage of this program. It's really great. They'll have 2 hygienists here. They kind of roll in and like unpack their whole like dental chairs, everything. It just kind of all comes out. And so, yeah, great opportunity. But I think that's all as far as the grants go.
With our FEP grants, they have to be reviewed. We haven't made any changes to them, but the truck and train wreck protocol, the foodborne, waterborne illness protocol. I think are the only 2 that those are the 2 that I need to review. Like I said, we haven't made any changes. You can look over on, those are the ones I had laying out. I have Dr. Taylor's signature for the truck and train wreck. After you review the foodborne, waterborne, I'll have you sign this one too, but, yeah, we haven't made any changes. It's just that time of year that you get to check them out and see what we would do in a situation.
What we have done.
Yes, what we have done. The other thing, we are putting on a highly infectious disease tabletop exercise. The state actually is putting it on. Have these, if any of you want to come and join, the state puts it on for us. It will be on measles, so perfect timing on that. It's a time for us to take our protocols and just see where our gaps are at and see what we need to update. So even if you don't think you have a part, I mean, just being a part of the Board of Health, you do have a part. So if you want to join us, feel free. I'm not positive where it's going to be yet. So if you want to join, email me and I'll make sure to get you an email sent out as to where it's going to be. But that is on the 20th, so next week. So anyone who wants to be there, let me know.
Please do. It's kind of interesting to go through these plans when we sit there.
Oh, sorry, the 25th. Sorry, yeah,
Yeah.
Okay.
it's on the 25th.
Sorry.
Sorry.
Interpreting.
Yes, I appreciate that. Let me know by the 20th.
We prepare for these kind of things, but we never really roll through our plans and stuff. And so it's nice to kind of see like where our gaps would be in our community and stuff like that, like where we would go, what we need to do. So I think our last one was on salmonella outbreak. Not the one we did, I think. Corinne was there. I think that's the one we did.
It was a foodborne illness.
Yeah, we called up Chuck.
Where we kind of interactive.
Yeah.
Okay.
Yep. That's it. Unless Casey, do you have anything about your grants that you would?
You pretty much covered them. I mean, I'm a child in the office right now, just waiting. Tobacco funding at a federal level has been cut completely, so we're waiting on a few things at the state. Kind of with that grant Amy was talking about, since our last meeting, I went to Bozeman. I was trained in youth aware mental health, which I'd like to get into the schools and just kind of waiting to hear from them to see if we can get that done. And then next 2 weeks from now, I'm gonna do youth mental health first aid. I have the adult mental health first aid, but I'm gonna do the youth mental health first aid. And Montana State University Extension is paid for both of those, so hopefully we'll know more.
Cassie, do you have anything?
Well, I had just gone to Helena to do, car seat recertification for a day. so I'm good for 2 years now again. And then we've just been, now that Gary and Leo's was bought out by Stokes and switching over, then just working with the store in the state, trying to get WIC up and running there, so, which is going well. Next week, we had gone to the Breastfeeding Coalition for WIC.
Breastfeeding Learning Collaborative.
That was a good one for us as CLCs. And then, next week I'll be going to perinatal mental health conference in Helena, so looking forward to all of that.
Any questions? I have one, on that, 15,000 equipment, grant for telehealth, correct?
Yes.
Okay, so where is that teleing into? Where's the counselor or person that they're talking to?
Well, if they have their own, they can just hop on a Zoom however they normally talk to their counselor. If they want to set up through this Manage XR, they have other counselors on there. So it's up to the individual. Like we have services if they don't have them already, but if they already have them, they can just utilize the space. Cause I know a lot of individuals don't like to do like their telehealth, room, their telehealth stuff at home, like if their family's
Sure,
home or whatnot.
sure.
And so this would just give them that private space.
Okay, so it's giving them for their own counsel.
Yes.
Gotcha.
Yep. Yep.
I don't know if the hospital is, Logan is, with Billings Clinic, we had a meeting down there 6 weeks ago or 2 months ago. And they're really ramping up their telehealth out of the Billings Clinic. There's a whole floor and building that's amazing. They call it the transfer center. So it does more than just telehealth, but there's a row of offices along the side there that's for telehealth. And it's in the lower level of a hospital, so there's specialists there, you know, that are working upstairs and can be available for various problems. Anyway, it's very impressive, and I thought, because they have the huge screens all the way around the room, and those are the hospitals in Seattle, Salt Lake, Denver. I mean, it's just amazing. And so they have a incident and they need to get a patient transferred from Conrad to somewhere because of something. They know what hospitals are available, what rooms are available in those hospitals, what the plane is gonna fly into Conrad, pick them up at the airport, or the helicopter is gonna take them to Great Falls, and then whatever. It's all orchestrated. It's really impressive. But anyway, the part where I'm going with this is the telehealth. And so that will also be out of that area too. So I mean, telehealth is the future. So I think we're heading in the right direction.
That was, my thought was a teleconference room in the hospital itself. Applies legally, would never work.
The only issue there is then we have the individuals that don't use Logan Health that would prefer to use Marias, and then we, you know what I mean? Like we have all those, that's why I was looking for a really neutral, just a very neutral, yes,
Neutral.
yeah. Yeah, that way nobody can be like, well, I don't go there because I'm not a patient there. Well, that's not an excuse. Yeah,
And legal issues though, if it's in a conspicuous area, I mean, you're talking about potentially high risk people and you
yeah,
have to be, I think you have to be a little careful
okay,
with regards to, you know, I don't know if you want to have it, so I still did that, and things can happen, or that you want to happen too.
mhm,
So, just something to think about.
Okay.
You know, choosing a location,
yeah,
trying to think of the hospital where you could do it and. You want, because you're talking 24/7 access?
no,
Okay.
no.
Oh,
No, just because
okay.
normal, I mean, this would be like for normal appointments and stuff like that for individuals. As far as like 24-hour stuff, we would, I would like to look at what Teton County is piloting. They are doing a iPad when first response shows up and they're able to work through behavioral health and mental health stuff. As of right now, it's kind of the call 988 still. But no, I would want it during like normal functioning hours. Because we even thought about a place like over where we're at, like, I just didn't want anybody to sit there and be like, oh, it's time for your appointment, Farmer Joe, you know, and so to have that, so they just had that. Able to be inconspicuous if they want to. So, but yeah, I never, thanks. Anybody else have any ideas of like what? Cause it's just kind of popped up and I was like, well, this grant had to be due, it was last Friday.
Space in the north part of the mall.
Okay,
Offices were,
okay,
I don't know if there's anything over there available.
I don't know.
Well, there's,
Area needing use.
there's several over there, but we don't know how long we're gonna be there either.
Okay.
I paid my rent this month, but
Okay,
there's lots of talk that we're getting booted and Village is moving over and we don't know.
okay.
It's a lovely feeling, isn't it?
Yeah, well, then I'll quit coming to Conrad. That's my answer.
Okay, sanitarians report.
Okay. Um. So, I'm Corinne Rose. I'm the county sanitarian. I don't know that I've met you.
I'm David Cage, I'm there.
Oh, okay. I think I have in other meetings, so good. Thank you for coming. So my report under the environmental health and food safety. So IGA is now Stokes's fresh food market. I have been trying to get out there and do just my regular inspections, and it just seems like I'm finding an increase in critical violations, which in places that that have been doing very well, and that of course requires repeat inspections. I've had inquiries on licensing requirements for 3 mobile food units. Starting October 1st, we are going to be required to use a new digital licensing establishment database, which means you'll have a tablet or an iPad, go into facilities and do your inspection on these tablets, and then the operator will sign digitally. You will email them the copy of the inspection, and everything will get uploaded into this state database. If you still want to use paper for your inspections, or some of them, you will then have to come back to your office and copy everything onto your tablet and upload it. So it'll be a learning curve for me, but I will do it. Of course, the county is going to have to purchase the equipment, which we can do. Also, starting October 1st, new state legislation is requiring public accommodations that serve food to their registered guests to actually have a retail food service license. Up until now, they've been required to follow the rules. They just weren't required to have the actual license. So I will work with, I have, I'm going to say the Super 8 and the Buffalo Wallow that actually do provide their guests with food. The other 2 smaller public accommodations, other than our bed and breakfast or tourist home, they at this point aren't serving food to their guests. But we'll get that done. We'll get them licensed. There is going to be an increase in all establishment license fees. Some of them are going to double. Some are going to be coming close to doubling. They've also created a few new definitions of establishments. For example, right now we have food service and a food service large. And a food service, regular food service is 85, a food service large is 115. We now have 3 categories: a small, a yearly fee, which the license goes from January 1st through December 31st, is 150. A medium is 225, and a large facility is 275. And for Ponderay County, a large establishment here in Conrad would be like Stokes's grocery store. So that will be a little bit of a change for our folks. Let me see, I just recently got a dog bite that I did follow up on as far as Department of Environmental Quality. Back in March, I worked with Representative Jones and some DEQ staff to present legislation to revise categorical exclusions from non-degradation authorization. And I know I've come to the board with these frustrating things, and like for a septic system, in order for me to permit a new septic system or an increased source of wastewater, we have to address non-degradation, which takes into account background groundwater, which for a large part of Ponderay County, we don't have any usable groundwater. I think in the Conrad area, of course, we have public water from Lake Francis. Going to the north and to the east, we have Tiber. Conrad supplies water to a large area. And so Lou did introduce legislation right at the very tail end of the session. So we were kind of in a hurry to get this going. What my idea was, and this is how I presented it, is that I've been struggling with addressing non-deg in areas here in Ponderay County where there is no available groundwater and the very few old wells that exist are not used for anything, let alone potable water. Most of these areas are served by public water systems, either with a connection or people haul their water, such as the Tiber Public Water System or the Conrad. And so Representative Jones introduced House Bill 923 and it passed. We need to,
Oh, hold on, it's working now.
it wants me to shut up. So I was quite thrilled that that passed, but it's the way what passed is actually a wastewater discharge that otherwise meets the criteria of this rule may be reviewed for non-significance without a background nitrogen sample required in 4C II in settings where groundwater cannot be sampled due to absence or great depth of groundwater, which we've got like water monitoring wells around that do have some water in them. There isn't enough quantity to do anything, and the quality is nasty. So I'm going to have to go back, and of course, the DEQ folks are tasked with writing rules to implement the new law. And I'm hoping that they will take into account the intent of this legislation, because what we ended up with isn't very helpful. So I will just go from there. We actually had a meeting with Representative Jones, DEQ Director Sonia Nowakowski, and the Water Quality Division Administrator Lindsay, and that's a tough one too. And so we met with the commissioners. We visited a person that is north of town that's hoping to put in a new septic system for his home, his existing home, and then a new business. And then we also met with the frontline ag folks because they're having big issues with this too. I thought it was a great meeting. They listened to us, they asked questions. I'm not sure what's going to come out of it, but at least they came here. They were actually here. They spent a lot of time and kind of could see the layout of the land and what we're dealing with.
The whole goal is to try to cut down on groundwater testing because there's essentially no groundwater to test.
No usable groundwater. So we need to test groundwater, the closest groundwater for nitrates and specific conductivity. And then, a new septic system or an increased source of wastewater cannot go above certain parameters of that. So if you start with, I'm gonna say a low nitrate, you can probably crunch the numbers to show that a septic system isn't going to increase the nitrate at the end of a mixing zone above required numbers. But in our case, we have no usable groundwater available. So even if we, for a new system that we put in to the east of Conrad, they took a water sample from an old well in that area, and it showed that the specific conductivity was very, very high, and it was like considered a class 4 water, which those waters you don't have to worry about non-dig. But my thought is, we know there is no usable groundwater in this area. And to require somebody to go around to try to find an old well, to try to sample water, and it may pass, it may not pass, just doesn't seem productive. I mean, nobody's using any groundwater. So yes, we need to protect groundwater, but when there isn't any groundwater that anybody's using, even for livestock, even for irrigating, it just seems like we should be able to say there is no usable water within, say, 5 miles down gradient of a system or a mile up gradient. I mean, west of Conrad, we do have some wells, and absolutely, we need to look at it in those situations, but
My thought was just, it's not gonna affect wastewater disposal from out of county necessarily. That doesn't affect that part of,
this is just for like a septic system, an on-site subsurface wastewater treatment system. That's what I deal with. So with Frontline Ag, they actually have a public system, but it is a subsurface drain field. So they are going through DEQ, and it has to be engineered, and DEQ has to approve everything. So I was so glad that Ken Wheeler could be at this meeting, because his whole project, the whole thing got totally held up for several days because the engineers and DEQ, DEQ says, well, you have to address non-dig, and the engineers are saying, well, there's no groundwater. There's no usable groundwater. And so he probably lost several $1,000s in that when everything was put on hold. And for what? There is no usable groundwater. So even for those folks, they should have been able to document that. There are some groundwater monitoring wells, and like Ken says, well, yeah, we have some even in town here that they're monitoring for oil and gas concerns. And he said, we didn't want to touch that one with a 10-foot pole because it would come back with possibly either some vapors or actual product, and that shouldn't affect their new site clear on the other side of Conrad, but they were afraid it would. They did get in touch with Montana Salinity Control, and again, these are monitoring wells for just sampling the salinity in groundwater, not necessarily for human use. And so they're going to have Scott Brown pull some samples from around Conrad and hopefully get their project back on track. But again, for what? We know there is no usable groundwater. So we'll just keep going on. And the requirements for non-dig are for drinking water standards. I mean, it isn't even, you can raise it above and beyond that and say, well, it'll probably diminish after a while, or the crops will utilize it or whatever. But it's very difficult. So I'm not just sure how this will end up. But I'll keep you posted. So a couple local solid waste complaints. One that we as a board have looked at before is a person from Brady who he has no water or sewer on his property, and he still lives there with several people. I've been in touch with him quite often, nagging him to, I just think hooking to their public water and sewer, he has no money, at least enough to do that. So on May 11th, I had a complaint, a verbal complaint that you got to do something. So I wrote to this person. I said, I received this complaint. I will be there next week at this time. We've got to get moving on this. And I did go there and he was waiting for me. His portable toilet has been full for quite some time and he has no money to get it pumped. And I said, no, that's not an option. You have got to get that done. You've got to get this trailer full of garbage taken care of. You've got to get this area mowed. You need to take care of some junk vehicles. So the garbage did get hauled. As of yesterday, he still has not got the portable toilet pumped, but he did send me a picture of a $300 money order. So when they do come, and he claims he's made several phone calls, he has that money order to give him. In the meantime, I have received a petition, was it by 22? What did I tell you? Was it 42?
Yeah.
Okay. Many Brady people have signed a petition that they want that cleaned up. And because we've received a signed complaint from at least 2 people, we will proceed with the Pend Oreille County Community Decay and the litter ordinance. So I will work on that. We did use those 2 ordinances here last spring on another Brady property. And I'm going to say after many years, after many letters, my first letter to this individual was clear back in 2007, many visits. We finally got 2 signed letters complaining about the conditions on this property. We jumped through all the hoops, sent out the letters, sent out the registered letters. Still no response. And thanks to the commissioners and thanks to our county attorney, we did go to court and it was found that the defendant shall pay any and all restitution owed to the county for the cost of removing the materials shown in the picture evidence submitted to the court. Defendant shall pay the county of Pend Oreille for any man hours at employees' hourly rate, along with any costs and dump fees associated with disposing of materials from the property. And the county shall immediately have the right to abate the condition of the property by removing all property which meets the definition in the ordinances. And then it talks a little about the junk vehicles, which my plan is to have 15 junk vehicle release forms in the road crew office before I leave the office today, so they can start hauling those off. I did have Commissioner Drzezinski go with me yesterday. He is, with his auctioneering experience, and he is an appraiser. He helped me determine that all the vehicles, except for one 2-ton truck, do have a value less than $500. So hopefully we'll get those removed. And then there is an awful mobile home on the property, which from the first of the year, if it hasn't been taken care of, we can remove that under the junk vehicle program.
First of the fiscal year, July 1.
Right, yes, yeah, thank you. So we've had 4 subdivisions in the works or complete, a new inquiry about a subdivision, several inquiries about a 1-acre tract. This is was created in '08 using a utility exemption. It is on the southeast corner of Lake Francis. Several people are interested in this, wanting to know how they get that sanitary restriction removed so they can build and have water and sewer. So but it's also, we're not sure about the floodplain or inundation issues, so we're looking into that. But it is kind of interesting. And then we come to the EPA Class 5 underground injection control wells that are still pending. We have not heard from either EPA about that. The commissioners and I and other folks have had meetings with Senator Gaines's staff, with Representative Zinke's staff, and Representative Downing's staff. So we kind of put together kind of talking point letters. So we are wondering if the Board of Health would be willing to join us. I wonder if I did not grab them as I'm carrying up here at the last minute. Bet they're sitting on my desk. Basically, so Montana Renewables, Calumet Montana Renewables, that is the entity that wants to make this sustainable aviation fuel. They received a 1.4 billion with a B. How is that? Guaranteed loan from the Department of Energy to ramp up expansion to help make this happen. In this Department of Energy grant, the wastewater treatment plant is like phase 3 of the project at the very back end of this huge expansion. We want that wastewater treatment plant moved to the front. And so that's what we're asking our federal representatives to push. Daines's office was very instrumental in getting that Department of Energy loan released, because for a while everything was frozen. But he helped get that released. I do think, and after visiting with their staff, and actually Downing was here, they are very interested in this. So Daines has connections with the Department of Energy, or yes, no, the Department of Defense. So help me out here. Downing is a good friend of is he also a good friend of the Department of, where did Jim go? He disappeared just look for him. But they have connections. They have good connections. Downing knows the new EPA director. So we're hoping that they can, and they listen to us and they asked questions. To us, it's just insane that they will not take those underground injection control wells off the table. They say, no, we probably won't use them, but we won't publicly commit to that. And we're kind of dealing with two things. Even if Montana Renewables has their own wastewater treatment plant, those wells could still be permitted and somebody else could be using it other than above and beyond just oil and gas folks. So we kind of have two things we're keeping our eyes on, but we really want Montana Renewables to put in that wastewater treatment. So what I can do is email these letters, or I can run down and get them if you want to read them quick and sign. whatever, kind of coming up against the hour here.
It's almost one.
Yeah, so Jim helped me out. Cause I left the letters on my desk.
I didn't see him. Have them in a folder. I couldn't find them on your desk.
Oh, bless you. Maybe they're on the printer.
Here.
No,
Yeah,
well, okay. Well, I do want you to know what you're signing.
Right.
And
Email it out.
Yeah. Yes. And before we've just piled up responses to emails. If people say, yes, I do support this, I just copy those emails. I do think, I think anything will be helpful. We were told by the representatives, yes, have the more the merrier. We will share it with our people. So
The other side of that too is the rail yard in Shelby that they've been using to haul the wastewater to and then shipping it out on. They just expanded with another 1.5 miles total of new rail lines. And so whether that's, and then visiting with people up there, it's not just for oil or wastewater going out, it's for stuff coming in too. And so, but be like the Camelina oil, crushed oil seeds, whatever else coming in and out of Canada, we trucked from Shelby to Great Falls. But they could also be for other waste products that would come and then get trucked to the wells, if the wells are permitted. Even if Calumet doesn't use them, they're still over free game, fair game. So the infrastructure build is scary, quite honestly to me, to put another 1.5 miles of rail in. And for a potential, and trust me, they're working very hard on the oil and gas side to use those. And I brought it up with the legislature, a few legislators and Montana Association of Counties, and there's very little excitement about taxing injection wells like some other states do. Me, we're looking for revenue, raising property taxes, but when I say, well, let's tax it if it happens, I get very little. I get none. No positive responses. So I think we need to keep fighting this like very hard reasons too. So your letters would be appreciated.
and I do have them here. I even had them labeled, so. So I can make copies quick or just send them out via email, whatever. Okay, I will put them in an email. Then we can print them and sign them. Perfect. And if you have any other suggestions or want to write letters on your own, I encourage you to do that. Any questions? I'm going to say one more thing. So here we've got our EPA saying it is okay to dump literally billions of gallons or billions of barrels of high strength industrial wastewater into what they classify as an underground source of drinking water. And on the other hand, on a state level, I can't permit an individual home to put in a drain field because the nitrates and the phosphoruses might contaminate some groundwater where there is no usable groundwater. So
That's where
it's
going with that one. They were just gonna,
Yeah.
they can just start dumping the water on their ground if they wanted to, then based on what you're saying. It's not, that's my worry.
Yeah.
That's what I was reading with what you were talking about.
Yes, I exactly.
They can
So
start dumping it out in their field if they want. I mean, what's gonna stop them?
So.
And that's why we're about this buildup.
And they keep saying it's, we call it high
high strength industrial.
wastewater. That's not our phrase. That's the water, Montana water.
That's DEQ. That's a high strength industrial
And so the
wastewater.
trucker that's been trucking all of this, he's from eastern Montana. I mean, he's the head trucker. He hires. So, but anyway, he's a farmer and he said, crap, there's gonna be that much water there. Let's buy some land outside of Great Falls, put up some center pivots, start growing stuff. And his words were, after 5 or 6 years, that ground won't grow anything. So don't tell us that that's good water, you know, it's.
It's,
County can't levy the tax? That's without.
No,
in your
we
jurisdiction?
were told that, we don't have a stake in taxing water below surface water.
that is all considered state water. Any groundwater is, any ground or surface water, here it is, state waters means a body of water, irrigation system, or drainage system, either surface or underground. The term does not apply to ponds or lagoons used solely for treating, transporting, or impounding pollutants, or irrigation waters or land application disposal waters when the waters are used up within the irrigation or land application disposal systems. Basically, you're irrigating a field, the water doesn't flow into a drain ditch. It's totally used. Everything else is considered state waters. Per Montana, per MCA 75-5-103-32A.
The problem,
That,
that doesn't make the state's problem, and
that's the funny part.
this is state's law, it's not.
They don't have primacy over any injection. EPA has a primacy over all injection wells except the class 2, which are under the Board of Oil and Gas. All the other injection wells are permitted by EPA.
Okay, any other business? Questions for Frank? I'd like to just emphasize what she said, between Corinne and her bulldog attitude on this, on the properties that are trashed. And our county attorney, we have a county attorney that's willing to prosecute. We haven't had that in the past, and so hopefully we can make some progress. Corinne's just knocking it out of the park. When we visit with Dane personally, or his staff, think he's personally, our staff, all three have been at county. They all walk out of here and go, you've got a gem right there. And I mean, Corinne's doing an outstanding.
Well, thank you, but we're a team here.
Yeah.
We're all after the same thing, which thank you, Board of Health, because I feel you've always had my back, so.
So the letters from the Board of Health would be tremendous, because everybody said the same thing. Troy Downing was the reason for me to say, and again, she pointed out the relationship with the head of the EPA, and they just, letters from the Board of Health would be very their work. Okay. Well, if there's no other business, or any other questions, is there a motion to adjourn?
I motion.
For the motion to adjourn, is there a second?
Second.
Okay, we are adjourned. Thanks much.
You've been busy.
You know.
It has been busy.